For more on flattening the COVID-19 curve, Dr. Amina Ahmed is a public health physician and medical officer of health. She joins us here in Lagos. Thank you for joining us on the program.
Thank you for having me.
All right, first I want to ask, do you think we're seeing perhaps a reduction in terms of the infection count, looking at the last couple of days in Nigeria?
Yeah, from the results we've been seeing from NCDC, yes, we seem to be going down where the curve is being flattened somewhat. So we're having less number of cases than we had about a month ago or two ago. So I think it's coming down. If perhaps we're doing enough tests, as it were, we're carrying out enough tests. So I think the figures are coming down.
But our testing isn't even up to 300,000. I think we're around 280-something thousand. So with that in mind, with what we knew last week and with some of the data that some of the state governments have talked about, do you think there's even proper surveillance at the state level that's taking place, contact tracing as well?
Now, it's possible that there's some laxity in that in some states, but I know that the strategies, of course, for control would involves enhanced surveillance, contact tracing, testing, identifying these cases as soon as possible, and isolating them either at home or in the hospitals, as it were, so that they can be cured, they can be managed for COVID-19. But we can't say for sure because the testing in Nigeria isn't at par with what is supposed to be per million in as it's supposed to be in Nigeria yet.
So what's your take? There's been talk about a second wave or a second peak. Some have even said that maybe COVID-19 will be like the influenza. It spreads and then it disappears, perhaps ends up in some hemisphere of some sort.
Well, it's novel. There's been new things keep coming up, symptoms one today, another one comes up tomorrow. So it's from what the scientists have seen, yes, there's a possibility of a second wave. In fact, there have been second waves in some countries. They've gone down, come out, released people, and they've come out of lockdown, and then another wave hits them. So there's a possibility that it's going to be a second wave, perhaps another wave, or it keeps coming and going. So, and that's the more reason why I think the scientists are looking at it that, okay, instead of just sitting back and waiting for it to go away, perhaps we should look at how the strategies we're going to use to perhaps stay with it and prevent these infections in people and move on with life.
Let's look at Lagos. Schools are, reopening today for exiting students, and you just saw that report, I think the Vetland Grammar School. Are you impressed by that? Do you have any concerns?
Surely, I have concerns. I would have expected that schools would wait perhaps until we see that the numbers are really this is just about a week of numbers going down. So we haven't had enough of it per se. And this was during the week of break period. So perhaps logistics may have made the numbers to go down and all of that. But when you look at it again, some other sorts of, West African countries are going on with the exams. So Nigeria is probably looking at itself as going backwards and leaving the children at home. So they don't want them to lose the year, and they're thinking that, okay, they should go back and join schools in time for exams that will be coming up, I think, on the 17th or so. So I think that's the more reason why the schools are returning. Perhaps, again, the state is perhaps ready for the students that are coming back with the preventive measures, hand sanitizers, wash hand basins or Victoria buckets, as it were, perhaps the social and physical distancing in classrooms, as we saw in the clip that you showed earlier on. So I think that's what the state government is looking at, as if these preventive measures are put in place, and then, of course, the students can come back and write their exams so that study for some time before the exams come up. And I want to believe also that these measures would also be put in place in the halls that they're going to use for the exams also, so that the students will be there with their face masks, maintaining physical distancing, although it's very difficult with students. With children in school, it's difficult to tell them all of these things, but we have to start to imbibe this in them because eventually schools will reopen whether this year or not.
And finally, we understand that there is an emergency room supposed to be set aside in case anyone has symptoms of COVID-19, and then that the teachers have been told what to do. Should it be the teachers, or do we need to have a medical person attend, in case there's an emergency in all the schools?
Of course, yes. In all schools, there's usually a sick bay or so for students to be carried to when they're ill. So I suppose they just wanted to, invigorate or to make sure that the sick bays are functional. So once the students are found to be having symptoms, or teachers perhaps, they'll be taken there before they'll be taken away from there to contact the NCDC personnel that would come and pick them up for the testing and management.
All right. Well, I'd like to thank you so much, Dr. Amina Ahmed, Public Health Physician, Medical Officer of Health. Thank you for joining us on the program.
Thank you so much. Thank you.